So our guest today is the Medicare Coordinator for Hillsborough County ServiceLink. She's a certified state health insurance assistance counselor and holds a certification for Community Resource Specialist, Aging and Disabilities. Please join me in welcoming Michelle Magarian.
Thank you all for attending, and thank you, Carol, for reaching out to me and inviting me to come to present today regarding ServiceLink and Medicare options. Again, my name is Michelle Magarian, and I am the Medicare Coordinator for our Hillsborough County ServiceLink office. We do have two locations for ServiceLink Hillsborough County. One in Manchester at the Easter Seals building at 555 Auburn Street. And we also do have one housed at the Nashua Senior Center at 70 Temple Street. I have been doing Medicare counseling for about 19 years. I started as an intern in college and thought, this is something I can do, and still today I'm still thinking it's something I can do. My coworkers sometimes think that I've lost my mind, and they ask me, how come you can continue to do this? And I feel that each and every day Medicare is an evolving program. There's always new benefits that are being offered, and it allows me the ability to help individuals to navigate the complexities of the Medicare system. So welcome. And I do work for ServiceLink. I've been with ServiceLink actually this year. This week, I'm actually celebrating my 14th year at ServiceLink. So I've been here for quite some time, and I've been doing this particular role for this long. For those of you who do not know what ServiceLink is, we are an information and referral agency. Primarily, we were established in 2000 as an aging and disability resource center, primarily focusing on seniors and adults with disabilities. And a few years back, we went to the no age, no population. So we are like the no wrong door. We do have 13 ServiceLink locations throughout the state of New Hampshire, and ServiceLink is a program specific to New Hampshire. So we are New Hampshire's Aging and Disability Resource Center. In 2003, we partnered with the University of New Hampshire and the Department of Health and Human Services, the Bureau of Elderly and Adult Services, to be able to provide these services to individuals within the community. In 2006, New Hampshire, the state of New Hampshire became the first state in the nation to provide this kind of aging and disability resource center model. So people will often ask us, like, what is the difference between ServiceLink and 211? The big difference between ServiceLink and 211 is that we are more comprehensive. We do a little bit more hand-holding of individuals. People will call us for programs like for Medicare, Medicaid, long-term support. They're moving mom or dad from another state to New Hampshire. How do I do that? Also, we have the Caregiver Program, so the Caregiver Respite Grant. Prior to COVID, we did a lot of face-to-face appointments. We did a lot in the community. We cannot take individuals in our vehicles, but we would go to individuals' home and help them compile their documents that were needed for various programs. So hopefully in the coming months, as people start getting their vaccines, we'll be able to potentially go out to the community, because right now, unfortunately, we cannot see individuals face-to-face due to the COVID pandemic.
Michelle, we have a question already. Emily wants to know if the information you're giving today would be good for her mother who lives in Massachusetts.
So Medicare is a program that is a government program. So there's some things that are the only areas when I get to the Medicare supplement rate information is that Massachusetts is one of the states in this nation that does supplement policies a little different than others do. So other than that, yes, but ServiceLink is specific to New Hampshire. In Massachusetts, they have what New Hampshire, we call ourselves the SHIP, the State Health Insurance Assistance Program. And in Massachusetts, theirs is called the SHINE.
Oh, okay. All right. Thank you.
You're welcome. So the programs, again, that ServiceLink offers, we are a free and confidential service. Our office is open from 8:30 to 4:30, Monday through Friday. We do provide the one-on-one counseling and assessment needs. Again, we do primarily usually some in the office, homes, and community, but due to COVID right now, we do Zoom and phone calls to be able to help individuals. ServiceLink team, we work closely with the Department of Health and Human Services. So we do have a specific department, Division of Family Assistance Specialists that we work with to help individuals when they're applying for their Medicaid benefits. So who works at ServiceLink? We have our ServiceLink staff consist of our center manager. Our center manager oversees both locations, Manchester and Nashua. Her name is Mary Frances Shonley. So if anyone has ever met her or seen her or needs to speak to her, she would be the individual in charge. We do have options counselors. We have 2 options counselors, one located in Nashua and one in Manchester. We have a caregiver specialist. The options counselors' names are Joanna McCormick for Manchester, and for Nashua, it's Cassidy Donahue. Our caregiver specialist is Amber McAllen. She oversees all of Hillsborough County. We do have 2 Medicare individuals, myself, which they call me the Medicare coordinator, Michelle Magarian, and we have a Medicare specialist in our Nashua office, Lisa. So our options counselor helps individuals with their long-term support needs. Again, people who are potentially moving mom or dad to another state, or that mom and dad or whoever that they are taking care of is now declining in health. They potentially need to get some services, whether it's in home services or whether it is in a long-term care facility, assisted livings, things of that nature. We are kind of the middlemen between the client and the Department of Health and Human Services. So applications come into ServiceLink, and the options counselor would then do the application electronically and submit that up to the state, and that kind of starts the process. The process for long-term care Medicaid is not a quick turnaround process. If people are applying for what they refer to as the Choices for Independence program, that is to keep individuals in the home and community as long as possible. Instead of going into a long-term care facility, there is an income criteria and an asset-based criteria. So the income for an individual is a little more than $2,300 a month. The assets are about $2,500 that they can have, period. So assets that they look at is stocks, bonds, CDs, IRAs, life insurance with cash value, any monies in the bank, things of that nature. The home that you live in or the car that you drive does not count as an asset unless you do sell it. The state at this particular point is doing a 5-year look back period for all assets. So if you or your loved one is thinking about potentially, or where they're at, that you would want to start thinking and planning for the long term for things. It doesn't mean hide the assets or give it away to Susie or Bobby, because the state does look at your bank statements with a fine-tooth comb. Is there any questions as of right now?
Yes, there's one question. Emily asks, are there any nurses employed at ServiceLink?
We do not have any nurses, no.
Okay.
No, primarily, all of us have our degrees of some sort in the health and human service field. So psychology, human services, things of that nature, but no, we do not have any nurses that work here.
Okay, thanks.
So our caregiver, next position is the Caregiver Specialist. She assists with the family caregiver supports, grandparent supports, and she does virtual caregiver support groups. So in regards to the family caregiver, right now there's some COVID grants monies that are available. So if you're taking care of a loved one and you potentially need some respite, then you would be able to apply. There is no income or asset based for this particular program. The only thing is that you cannot use the caregiver respite grant just to be going to and from work. There's the grandparent caregiver respite grant, because today we face a lot of grandparents that have custody of their grandchildren. And so you could potentially get money for that. And Amber is in the process right now of setting up a virtual caregiver support group. But I do know that there is a caregiver support group that happens Wednesday through Easter Seals program itself. Then there is myself. I am the Medicare Specialist, so I help individuals to navigate the complexities of the Medicare system. When I started doing Medicare counseling a long time ago, there was Medicare Part A, Part B, supplement insurance. That was it. Some of the supplement programs had some additional riders attached that had plans HI or J, which have not been available for a long time, that had prescription coverage attached with it. Those have gone away. But we sometimes find some of our very elders potentially might still have plans HI or J, but most very seldom do they. So we help individuals, because we're not licensed insurance agents. We cannot tell an individual what to take or what to do. We can only show you the programs that are available, and then solely it's up to you. We get that a lot, that individuals will say, then why did I call you if you're not going to tell me what to do? I can't tell my mom or my dad what to do. I can't tell a complete stranger what to take for their health insurance. And it's very important. And with Medicare, they give you a lot of choices. And so sometimes it can be a little overwhelming, but we do try to scale it back. And so, and help individuals to understand it a little more, break it down to some language that they can understand versus reading the Medicare and You book. If anyone has ever read the Medicare and You book as yourself, when you turn to page 5, it tells you to turn to page 25, and then you get to page 25 and you got to go back to page 5, and then halfway through it says to go to page 30. By the time you're on page 5, you're already like, where am I in this book? So they say that it's written at an 8th grade reading level, but it can be a very complex book to read. And for the last 19 years, I do have to read that book, at least glance over every year and see what might be some changes. So again, at ServiceLink, we are the State Health Insurance Assistance Program, also known as the SHIP. We have a contract with the state of New Hampshire. Everyone in our office is currently certified as Medicare counselors. Every year we have to go through recertification through CMS, the Center of Medicare and Medicaid Services, and do our continuing education, and to make sure that we are up to date with everything that is Medicare related. So again, we help individuals to navigate the complexities of the Medicare prescription drug program, also known as Medicare Part D, Medicare Advantage plans, also known as Medicare Part C, Medicare supplement policies, which is known as Medicare, the Medigap programs, and the Medicare Savings Program, which is also known to others as Quimby Slimby. So as I'm talking throughout this program, I try to make sure that I keep the acronyms down because as I just said to you, Medicare gives things many names, and that's where the complexities seem to be, is that people are not sure if they're looking at Medicare prescription, Advantage, Part C. They don't really know exactly what they want. So this is what an individual's Medicare card looks like today. A few years back, they did away with everyone's Social Security number used to be your Medicare identifying number. So to try to break down the whole fraud and abuse, they got rid of the Medicare numbers being your Social Security number to what they go to as a Medicare identifying a beneficiary, which is the MIB number now. Every Medicare card has your name, your identifying number, your effective dates. You'll notice on here that there is no signature line. The old Medicare card used to have a signature line. So they told you that you could not laminate that particular card, because any card that has a signature line, the government says that you should not laminate, but they did away with the signature line. So this particular card can be laminated now. Medicare is a federally government program, so people will confuse quite a bit. Medicare, Medicaid, why did they ask? They name it the same thing. So Medicare is a federally run program. Medicaid is a state-run program. So there's the two main components of Medicare, which is known as original Medicare. That is Medicare Part A and Part B. And with your Medicare, you can go to any doctor, any hospital that accepts Medicare. There's no in-network, out-of-network when you come to what they refer to as the original Medicare program. So we'll start with Medicare Part A, which is your hospital coverage. That's everything that happens on an inpatient basis. So with Medicare, Medicare starts on the first day of the month that you turn 65. Or if you have been disabled and under the age of 65, on the 25th month after applying for your disability benefits and being approved. If your birthday happens to fall on the first of the month, so if your birthday was February 1st, your Medicare would have started on January 1st. That's the only exception of when Medicare starts differently than the month of your birthday. If your birthday falls on the 20th of February, your Medicare would start on February 1st. So that's how everything with Medicare starts the first of every month. Medicare Part A applies to any hospital, skilled nursing facility, and home health care, medically necessary home health care. It does not cover any type of long-term care. So Medicare itself does not cover a long-term care stay at a nursing facility, only the skilled part of your benefit. For the most part, individuals do not pay a monthly premium for their Medicare Part A unless they did not work enough quarters. So the way that the Social Security office looks at it is if you have worked 40 quarters in your life, then that's a total of about 10 years. If you work that and paid into the Social Security Medicare system, then you do not pay for the Medicare Part A benefit. So the original Medicare Part A and Part B is all administered by the Social Security Administration. So people will often ask, like, well, is it just going to happen that I'm going to turn 65 on February 20th and I'm going to get a card for my Medicare benefit? The answer is no. If you are not collecting your Social Security benefit, or if you are not disabled, the Social Security Administration does not know that you're turning 65 on February 20th. It is your responsibility to contact your local Social Security office or to go on ssa.gov to apply for your benefits. So that's sometimes often the misconception, is that people think that they're going to just get a card in the mail, and that doesn't happen. So that can be sometimes confusing. So in order to apply for Medicare, you can apply. There's what they refer to as a 7-month period of time where you are eligible to apply for your Medicare benefits. 3 months prior to your 65th birthday, the month of, and 3 months after. Because again, sometimes there's that confusion that people feel that they would have gotten a Medicare card, and when they realize that they were supposed to sign up, then they do have that little bit of wiggle room to be able to get their Medicare started. So that is what Medicare refers to as your initial enrollment period. So with Medicare, they have a couple of different categories. Initial enrollment is when you are first eligible to your Medicare benefits. So the 3 months prior to your 65th birthday, the month of, and 3 months after. The special enrollment period is if for some reason you are declining the Medicare benefit, your Medicare Part A or B, then because you're still working and you have your spouse's benefits, then you can decline the A and the B and pick it up upon retirement. That is what they refer to as a special enrollment period. And then they have the general enrollment period, is when for some reason an individual didn't know that they needed to take the Medicare, and they decided not to, or for whatever reason. We run into sometimes people say they can't afford it or things of that nature, so they decide to not take Medicare. Then there's the general enrollment period. The general enrollment period for Medicare is January 1st to March 31st, and then it wouldn't go into effect until July of that particular year. So the way that Medicare looks right now is if you had just what they refer to as original Medicare, your hospital benefit, you would be responsible for the first $1,484 deductible if you were admitted into the hospital. And you'll see on the top it says per benefit period. So with Medicare Part A, your deductible period renews itself every 60 days. So every 60 days, if you only had original Medicare, you would have a new $1,484 deductible. If you're hospitalized longer than 60 days, you can see that days 61 through 90 would cost you $371 a day. If you were hospitalized day 91 through 150, you would be charged $742 per day. Most of the time in my tenure, I've never had people be hospitalized more than, a few days. So that usually is not ever an issue. Medicare has a lifetime of 150 days from the time you become eligible to Medicare until upon passing, that you have 150 days of hospitalization. And that is all that Medicare would cover for you for hospitalization in your lifetime. Under the Medicare Part A benefit is also your skilled nursing. So if you had a stroke or heart attack or something of that nature, and you needed to have some kind of rehabilitation, Medicare would cover the first 20 days 100%. Day 21 through 100 at this particular time is $185.50 per day. At the end of the 100 days. Unfortunately, if you're not getting any better, then you would probably need to then transition to long-term care Medicaid, which then would not, or long-term care benefits, I'm sorry, and then it would not be covered by your Medicare. And then Medicare does pay for a hospice care for you that is under the Part A benefits. Medicare Part B is your Medicare coverage that covers everything that happens on an outpatient basis. So things that are medically necessary, preventative benefits. Medicare Part B is the part that we do pay for. So with Medicare Part B, there is a monthly premium, but I'm going to stop right now because it does look like we have a couple of questions.
Hi, okay. Oh, Fred is asking, he said he likes the simplicity of your summary. Would you be able to make the slides available to us later?
Absolutely, yeah.
Okay, so maybe you can send them to me and I can post them on our website and send people a link. Yeah,
sure.
So Amy wants to know, to get into skilled nursing facilities, do you have to be in the hospital for 3 days prior?
So the way that original Medicare works, yes. There is the 3 qualifying days. It has to be inpatient, not observation. So that's what's very important, that you make sure that it's an inpatient stay, not an observation. So to ask about that. If you have a Medicare Advantage plan, they don't follow those same rules as original Medicare does. So that does not apply if you have a Medicare Advantage plan, usually with that particular policies.
Okay. And Elizabeth's asking, what happens when you run out of lifetime days? If you have Medicaid as your secondary, does that insurance then begin picking up the bill for both medical and psychiatric inpatient services?
Yes, if you have other insurance, correct.
Okay. And Teresa asked, okay, same thing. She'd like a copy of the slides too. So we answered that. And Chadrakanta asks, if somebody is observation 23 days, does Medicare pay?
If you're under observation, so observation is under your B benefit, not under your A benefit. So if you are not actually admitted into the hospital, then it would be under your B because that's an outpatient service. So it would be billed differently than it would be for a inpatient versus an outpatient.
Okay. And so it would be covered, Medicare would pay it under Part B?
Well, it's not, it's structured differently. So you would be responsible for after you pay your Part B deductible, you would then have to pay 20% of your services. And your medications would not be covered under the Part B as it would under your Part A inpatient hospitalizations.
Okay.
So it's very important if a person is in the hospital and they're moving them, so you come into the emergency room and they're transitioning you up to a floor, that it's really important that you ask, is this observation or is this admission? Because if it is under observation, then the way that billing is done is completely different. It falls under your Part B benefits, which will go over on how Part B covers versus on how Part A covers.
Okay. And then Chandra Kanta has another question. If someone worked for less than 10 years, what would be the premium for Part A?
So I can't answer that because it depends on the amount of quarters that you did use, that you worked, would determine on what your premium is. So it's not a standard premium for everyone. It depends on the number of quarters that you particularly worked.
Okay. And Elizabeth is asking, just to clarify, if Medicare says no because your days are exhausted, that is not the same as Medicare saying no because the treatment is not covered.
That's correct.
Medicaid would not deny it, correct?
I can't answer that question,
Okay.
whether a benefit would be
Medicaid.
denied by an insurance or not.
Okay. Okay. That's it for now.
Okay. So again, you have your Medicare Part B. That is things that happened on an outpatient basis. One of the questions earlier that I just went over about the inpatient versus outpatient for hospitalization. So again, this is how the structure works with Medicare Part B. If only you have original Medicare, you would be responsible for the $203 annual deductible. So that's one of the differences between the Part A and the Part B, is that the Part A has the benefit period deductible, where the Medicare Part B has the annual deductible. So that is the one-time yearly deductible. The 2021 deductible is $203. Then Medicare pays 80%, and you pay 20% of the Medicare approved rate after you have met your deductible. This is how the premiums are based at this particular point. So if you make less than $88,000 and you're an individual, then your premium right now would be $148.50. People often ask, well, how do I pay that $148.50? So people right now that are turning 65, their retirement age to collect their full retirement is not until like 67, 68. So sometimes people are like putting off getting their collecting their retirement benefits, and the Social Security Administration will bill you for your Medicare Part B premium, but they do bill you on a quarterly basis. So you would be billed for a 3-month at a time for your $148.50. If you are collecting your Social Security benefit, it comes directly out of your Social Security check. There's no questions asked. That's exactly how it has to happen. When Medicare is looking at the Medicare Part B premium, they look back 2 years. So as of right now, when they're determining individuals' Medicare Part B premium, they would be looking back to 2019's taxes. And what people will say is that, well, I don't make the same as I did back in 2019. Now I'm retired. Now I don't have that kind of money. You do have the ability to contact the Social Security Administration to file that they can reevaluate your Medicare premiums and look at that to determine if they would lower it to the average premium of the $148.50. But if not, then your premium would be kind of accordingly to what is on this structure. They adjust your premium, what they refer to as the IRMA, which is your earned income, adjusted gross income, is how they look at it to determine what an individual's Part B premium would be.
Okay, we have a couple more questions. Chandrakanta wants to know, retired and with Medicare at 66 years of age, Part A, husband has private insurance through his job since he's still working. When should the retired spouse start applying for Social Security?
So that is the Social Security benefit that has nothing to do with your Medicare itself. So that would be whenever you're eligible for your full retirement benefits or however you and your spouse would like to. If you wanted to collect now, you would contact the Social Security Administration and find out how much it would be versus when you would be at your full retirement levels.
Okay, and another question. I'm 68, still working and covered under my company plan. I did not enroll when I turned 65 a few years ago. How many months before I retire should I enroll to ensure no gap in coverage?
So again, with Medicare, everything goes into effect the first of every month. So what I say to individuals, unless you're kind of trying to keep it quiet that you're going to be retiring, give Social Security as much notice as you potentially can. So 2 to 3 months before you know you're going to be retiring and when your benefits are going to be ending, that you would want your Medicare Part B to start. When upon retirement and when your benefits end, to avoid any kind of penalties, you do have an 8-month window to be able to enroll with Medicare Part B without any penalty. If you go beyond that 8-month window, you would be subject to the 10% penalty that Medicare would associate with you not having what they refer to as viable coverage. So with Social Security, they refer to 2 programs. There's the viable coverage, meaning active employment, and creditable coverage, which means equal to or better than what Medicare has to offer. So in order to decline the Medicare Part B, you would have to have viable coverage. So there's a couple of rules when it comes to the declining the Medicare Part B. If you are over the age of 65, your company has to have 20 or more employees to be able to decline the Medicare Part B. If you are under the age of 65, it has to be 100 or more employees in order to decline the Medicare Part B without any penalty. Things such as VA benefits or retirement plans are not considered viable coverage. So therefore, you would need to take Medicare Part A and Part B to avoid any type of penalties associated with Medicare. If you are currently working and you have an HSA account, you would not want to take Medicare Part A or Part B because you cannot contribute to your HSA account if you have Medicare Part A and Part B. It does not work. So you would just decline both. You wouldn't even apply for Medicare, period. Because sometimes what people will do when they're turning 65 and they're still working, either themselves or their spouse has the benefits, they would decline the Part B and take the Part A because it doesn't cost anything. But if you have an HSA account, you do not want to take either A or B because it interferes with your contributions. If you have an HSA account, you want to stop contributing to your HSA account 6 months prior to being eligible for your Medicare benefits.
Okay. I think we have another one. So Chandra asks, enrollment for Part B, if not done because of husband's private insurance through a large corporation, is there any penalty even after 3 or 4 years?
No, there is no penalty as long as it is viable coverage.
Okay.
Yes. Yep.
Okay, thanks.
Yep.
No, that's it.
So what we run into a great deal, sometimes people will say they're not going to take their Part B benefit because they can't afford it. So there is a program at the state level that helps individuals. So this was one of the things that I told you earlier. It's called the Medicare Savings Program, but most of the time people refer to it as QMB. But there are different programs under the QMB, the Medicare Savings Program. There's QMB, which helps individuals to pay their Medicare Part A and Part B monthly premiums, also co-pays and deductibles. Then there is a program that's called SLIMB, which is the specified low income Medicare beneficiary program. That particular program only covers your Medicare Part B premium. So as you'll see on the slides, there's 2 different SLIMB programs. There's SLIMB 120 and SLIMB 135. The only difference between SLIMB 120 and 135 is that you cannot have Medicaid with SLIMB 135. So you would have to decide whether you wanted Medicaid or whether you wanted to get the state to pay your Medicare Part B premium. Oftentimes we run into that with individuals who qualify for the Medicaid program. The choices for independence, that their income is kind of on they qualify for the SLIMB 135. and they want to have that particular Medicaid program, they have to come off of the SLIMB 135 in order to get the Medicaid. So there are income guidelines and resource limits. This particular, so an individual who qualifies for the QIMBY program at this time, your income cannot be more than $1,083 a month, and your resources couldn't be more than $7,860. Again, the resources are the same for the Medicaid program. They look at stocks, bonds, CDs, IRAs, life insurance with cash value, and monies in the bank. Your home or the car you drive do not count as programs for that. So the Medicare Part B is everything, again, that is on an outpatient basis. So any lab works, any physical therapy, any doctor visits, anything of that nature. When it comes to original Medicare, again, there is no in-network, out-of-network. You can go to any provider that accepts Medicare. We have most providers today are affiliated with the local hospital, so all billing is done through the local hospital and not independent any longer. Then we have Medicare Part D, which is our prescription coverage. That follows the same criteria as the Medicare, original Medicare, your initial enrollment period, 3 months prior to your 65th birthday. The month of and 3 months after is when you're eligible to apply for benefits. You can go on Medicare.gov to create yourself an account if you have a Medicare number, and that's the best way to do it now. A couple of years ago, it was easy to go into what they refer to as the plan finder to be able to look at programs. You didn't have to have an account, but the way that it's set up now, in the last couple of years, they set it up that you would need to have a personalized account. So by setting up an account on Medicare.gov, makes you have a My Medicare account. So you can see things like when you went to the doctors, what was covered, what wasn't covered, things of that nature, when you potentially might be eligible for something else. If an individual misses the enrollment period, the 3 months before or the 3 months after your eligibility to Medicare, you do have the next time to enroll would be October 15th to December 7th is what they refer to as the annual enrollment period, is when you have an opportunity to look at plans for if you missed out on your initial, or you want to look at new plans for the following year. If you do receive extra help, you can, which is also known as low income subsidy assistance, you can change plans, look at plans anytime throughout the year. And you only have 63 days once you lose your creditable coverage through your employer or union or whoever you have coverage through, to pick up a Medicare Part D plan with any penalty. So Part B has a penalty of 10%. Part D has a penalty of 1% for every month you do not have a plan in place. So that's one of the differences between B and D, is that B does an annual penalty, D does a monthly penalty. So it's 1% of the average premium, which at this particular time is a little over 30 cents per month penalty. Do I have a question?
Yeah. So Timothy's asking, if a spouse is working and contributing to an HSA, is there an arithmetic guideline for whether to do continue contributing to the HSA with pre-tax dollars or to start Medicare? I think he's saying which one will be financially advantageous.
Unfortunately, I can't answer that question. I don't know enough about the HSA process.
Yeah. Okay. All right. Thanks. That's all.
So Medicare Part D does have a monthly premium. You can either pay the company directly or you can have it deducted from your Social Security check. Most plans do have a yearly deductible that they have that you would pay at the beginning. Plus, they do have copays in the coverage gap, which we will go over how the coverage gap works. These are all of the plans that are currently available for the state of New Hampshire for Medicare Part D. So the cheapest plan at this particular time is $7.10. You'll see that right here on SilverScript Smart RX. That is the cheapest plan, to as much as you'll see the plan down, $81.80. So some of the plans have deductibles and some of them do not. And some of them, some of the plans help individuals that are receiving the extra help, or also known as the low income subsidy program. So when individuals are looking at Medicare Part D plans, what oftentimes they'll say is, well, then why don't I just take the $7.10 plan instead of taking the $26.70, plan? Well, that's why it's important to go on the Medicare.gov website to make sure that the particular plan that you're going to choose covers your medications, because not all plans have the same formulary. So if your medication is not going to be covered by that $7.10 plan, then obviously you would not want to go with that particular one. So how the process works on the Medicare.gov is that you input your medications, say what pharmacy that you go to get your prescriptions at, and then it puts it into economic order for you on what would potentially be the best plan for you to take at that particular time. So if you go on to the Medicare.gov site and you do not sign up to create yourself an account and you just want to do a generic search, you can do that as well. The only problem is that your medications would not save. So the next time you would go onto that particular site, you would have to input your medications every time. Where if you sign onto the site and create your own, then your medications save from time to time. So therefore you can add and subtract medications and play with pharmacies and things of that nature, because every plan has what they refer to as their preferred pharmacies. So you might go to Walgreens, but you find that if you went with the WellCare Classic plan, that CVS is their pharmacy of choice, then you might want to change your plan to your pharmacy to CVS versus going to Walgreens. So you have the ability to play with that site a little bit. So again, low income subsidy, there is financial assistance for that. At this particular point, the income guideline is $1,595 for an individual, $2,155 for a couple. Resource limits are $14,610 for an individual and $29,160 for a couple. So there are different levels of subsidy for individuals to potentially qualify for, depending on where your income is. So you can get 25% coverage, 50, 75, or 100% levels of subsidy. Any questions about Part D? Okay. So we'll move on to Medicare Supplement Insurance. Medicare Supplement Insurance is also known as Medigap. It fills in the gaps that Medicare does not cover. In New Hampshire, this is one of the questions I had got earlier about, is Massachusetts the same as New Hampshire? So New Hampshire, we have ABCs. Massachusetts, they have gold, bronze, silver plans. So theirs is structured. There's only 3 states in the nation that are different that don't do the ABCs, and that's Massachusetts, Wisconsin, and Minnesota. They do the gold, bronze, silvers, where we do ABCs. If you were eligible for Medicare Part A prior to January 1st, 2020, you can still purchase Medigap plans C and F. If you were not eligible for Medicare Part A prior to January 1st, 2020, Plan C and Plan F are no longer available options for individuals. So that's one of the confusions right now in regards to the supplement policies. What can I get? What can I not get? These are how the benefits are structured. So you have, with Medicare supplement, they're called plans. So they have plans A, B, D, G, K, L, M, and N. Again, if you are eligible prior to January 1st, 2020, you can take plan C and F when you enroll with your Medicare Part B benefit. So as of right now, Plan G has a policy that covers benefits. As you will see them here, the only thing that is not covered is the Medicare Part B deductible of the $203. It does have there is an option for a high deductible Plan G, and that deductible is a little over $2,300 is what you would be responsible for before the Medicare would come, before your supplement insurance would come to play. At this particular time, so these are how, if you were turning 65 today, this is what it would look like in regards to the cost of a Medigap policy. So you'll see, if you call us and you're looking, because you want to look at supplement policies, you'll see if there's like no money amounts in that column, then that particular plan does not cover that particular policy. The plans are based off of men and women. So men tend to sometimes pay higher premiums than women do. But you can give us a call at our office, and we'd be more than happy to send you a price rate sheet for your particular age. So if you're 70 now and you're looking for policies, then definitely could have an opportunity to look at plans. So the way that supplement is structured today is that within the first 6 months of eligibility to your Medicare, can they not look at any pre-existing conditions? Once you're beyond that 6-month window, you're then subject to medical underwriting. So if you don't get a supplement policy within the first 6 months, after that, all of your stuff is sent to underwriting. And these policy premiums that I have the ability to show you is not guaranteed if you have any type of medical illness or conditions that would flag them to consider you a high risk for a particular policy. Any company can say no, that they will not cover you because the Medicare programs are not covered by the pre-existing condition policy that was put in place by the Affordable Care Act. So, that's one of the things that is sometimes confusing is during open enrollment, we'll get a lot that people will call us saying, well, can I shop for supplement policies? Well, absolutely, you can shop for supplement policies, but what your premium is today, you would be rewriting a new policy at the age you're at now. So if you bought a policy at 65 and now you're 75 and you want to shop for a new policy because you feel that your premium is going up too high, you would be rewriting a policy at 75, not at where you are at 65. So oftentimes it's higher. Plus, because you're rewriting a policy, you're now subject to medical underwriting. Any questions about supplement policies?
No questions now.
All right. So we're going to move on to Medicare Advantage plans. Those are also known as Medicare Part C. You have to have Medicare Part A and Part B to have both supplement or a Medicare Advantage plan. So without having A and B, you can't have either of those because it supplements your original Medicare. That you can enroll 3 months prior to your 65th birthday, the month of, and 3 months after. It also has the annual enrollment period, which is October 15th to December 7th. At this particular point, we are in what they refer to as the open enrollment period with Medicare Advantage plans, which is January 1st to March 31st, is when an individual has the ability to go back to original Medicare and a standalone Part D plan or go to another Medicare Advantage plan. People cannot come on to Medicare Advantage plans at this particular time. You only have the ability to make changes within if you found that your policy wasn't what you thought it was going to be when you signed up for it. So they have a new open enrollment period now where people have the ability to make those changes.
So we do have a question.
Yeah.
I'm still working, over 65, fully covered, and have an HSA. I did not sign up for Part A or B when I turned 65. Should I sign up for Part A and stop funding my HSA now and then sign up for B when I retire?
So you
Will I be penalized?
So when it comes to the HSA, you have to stop contributing 6 months prior to you're going to start any part of Medicare. So that everything is, when it comes to HSA accounts, it's solely up to the individual and where you're at in regards to your retirement. So 6 months prior to knowing you're going to be retiring is when you would stop contributing to your HSA account. And I would talk to your HR department at your company in regards to how the HSA programs work in conjunction with Medicare.
Okay, I have a question about that. So if you have a balance, if you have money in your HSA, when you go on Medicare, can you still spend it?
Right.
Mm-hmm. Okay.
You can still spend it, you just can't contribute to the policy anymore.
Okay.
Yeah.
Thanks.
Yeah. Any other questions?
Nope.
Okay. We are also known as the Senior Medicare Patrol. So we help individuals if there's any problems regarding fraud, abuse, or neglect when it comes to Medicare. That is another program that we are all certified under the CMS for that as well. So individuals have the ability. In New Hampshire, we're all together, the SHIP and the SMP. In Massachusetts, they are two separate entities. They are just the Medicare SHIP, and the SMP is completely different. We help individuals to make sure that there's no fraud, abuse, and always remember to protect your Medicare records, detect anything. So you do get your Medicare summary notice or your explanation of benefits from your Medicare Advantage plan on a quarterly basis. So to make sure that you are looking over your particular policies and to report any type of abuse or neglect or to your local ServiceLink office, but we always tell individuals to make sure that they double check with their provider to just make sure that it's not simply an oversight or an error. Is there any question right now?
Yeah, so Chandrakanta asks, what if the supplemental policy is not sought because of the husband's private insurance through work? Will the premium for the supplement change 3 or 4 years later when I'm 68 or 70 years old and I apply for the supplement then?
So the premium would be whatever the age that you're coming into that policy, yes. So if the policy when you were 65, for an example, I'll just give you, was $151, and somebody who is now 68, that policy is $183, then you would pay that current policy of the $183, not the policy you would have gotten at 65. Because everything at this particular point is aged attained policies, not issued aged.
So So if you applied at 65 and say it was $151 for the premium, then does it stay $151 every year?
No,
No.
a policy never stays the same. In an ideal world, that would be great, but
Yeah.
unfortunately, no. Policies do go up according to cost of living. So yes, it will go up, but it would not go from 151 to now you're 68. It wouldn't go from 151 to 183 as the example I was given. It might go from 151 to 161.
I see.
Because or however the average supplement increase goes up about 5%, depending on the COLA increase that individuals get, would determine oftentimes about what the premium would go up for your supplement policy.
Okay. All right, great. Thanks. That's it.
So again, individuals have the right to contact ServiceLink in regards to any type of questions that they have about reporting billing errors, suspicious patterns or behaviors, or the Office of Inspector General or 1-800-Medicare. If there are any other questions, if not, that is the end of my presentation.
Let's give them a minute in case anybody's like me digesting all the information and might come up with a question in the next few minutes.
Absolutely.
But, yeah. So
it's a lot of information to go over and to process, and
right.
So that's why we do provide the one-on-one counseling, and we and oftentimes we will go out to the community and do some prior to COVID, we would go into housing units and do like monthly meetings, so we can help individuals to understand the information.
Yeah. Okay. So, well, Emily just says, thank you very much, Michelle. This was very helpful. Jill is asking, how does one apply for the Medicare savings accounts like QMB?
So you can either do that through the Department of Health and Human Services directly, or you can contact your local ServiceLink office and we do have the applications.
Okay, and Timothy says many questions, but I don't know how to structure the comments. This is a good start. I hope to look at the handouts. Okay.
So if anyone has any specific questions that they would like, you can always direct them to me. My email address is Magarian, that's Magarian at eastersealsnh.org. You can reach me there, or if you have any questions that you come up with that you didn't think of now, you can always send them to me there. And if it's something that's too much to write about, you can always call me directly at my office. I am in our Manchester office at 644-2240.
Okay. And Chandrakanta says, very good presentation, and thank you for putting the slides out there to refer back to. And then Amy asks, if my husband is covered under my health insurance through work, when he turns 65, will my private health insurance be secondary to Medicare?
No, if he is not going to be taking Medicare, then your employer's benefits always stay primary. So the rule of thumb, like I went over earlier, is that if it is over 20 employees, then Medicare is secondary, your employer's benefits are primary. If it's less than 20 employees, then oftentimes the Medicare is primary, your employer's benefits would be secondary. So it depends on the number of employees at your agency would determine on who pays first.
Okay. And then Diane is asking, well, she just says, thanks for all you do. This was very informative. Just a minute. A lot of questions coming in. Okay. Can we set up an appointment to review our individual situation and questions?
Absolutely. Like I said, unfortunately, at this particular time, we're not doing face-to-face meetings. So we could schedule it as a Zoom meeting, such as we're doing right now, or we can do it over the phone, whatever is easier for an individual.
Okay. And Elizabeth asks, underwriting, that means any insurance can, so no, any insurance can say no to your request for enrollment?
When it comes to Medicare, yes, for Medicare supplement insurance.
Okay.
Only with Medicare supplement, because all Medicare supplement insurance are private insurance companies. So they have their rules and regulations that they have versus how it is for Medicare itself.
Okay. Deborah asks, how does Medicare work for the homemaker spouse?
I don't know. I understand that question.
I wonder if she means someone who hasn't worked, like the 40 quarters that you talked about.
So if you have not worked your 40 quarters, then when your spouse starts to collect their benefits, then you can draw off of their benefits to be able to get either your Social Security, if you're drawing off of them, or your Medicare. You would draw off of their benefits, but it would be when your spouse is collecting his benefits is when you can start doing that.
Okay. And then someone's asking if I could type your email address and phone number in here. So I'll do that right now if you tell me again. What's your email address?
It's Magarian at eastersealsnh.org.
Magarian at eastersealsnh.org. And the phone number was 603
644
644
2240.
2240. Okay. All right. And let me just go through and make sure I didn't miss any questions here. I don't think so. You've answered 26 questions.
Woohoo!
Yeah. So any last chance, if anybody has any questions, please type them in now.
And if not, like I said, you can give me a call. I am available Monday through Friday from 8:30 to 4:30. Depending on, if you call in and you're going to be new to Medicare, say July, we would, at this particular point, we would send you out what we have as a new to Medicare packet. And individuals can have an opportunity to look at that information, kind of absorb it, and then give us a call to set up a Zoom meeting or a phone. And if you already have your Medicare number, so say you were turned 65 already and you already have a Medicare number itself, and you set up an account on Medicare.gov, I can have the ability to go into Medicare.gov with you to see what particular policies might be good. On Medicare.gov is where you can obtain the information regarding Medicare Part D, which is your prescription coverage, and Medicare Part C, which is the Medicare Advantage plans. So it depends on the county that you live in, would determine on the number of Medicare Advantage plans that you're currently eligible for. For Hillsborough County at this particular time, there are 34 Medicare Advantage plans for individuals to look at. So it sometimes gets pretty complicated on where you're going. If you're looking at Medicare Advantage, always start with your providers to see what Medicare Advantage plans they're currently accepting, because when it comes to Medicare Advantage plans, those are county and state specific. So you must be able to make sure that your provider accepts that particular Medicare Advantage plan. That's one of the big differences between Medicare Advantage and Medicare Supplement, is that Supplement they supplement your Medicare. If you go to Dr. Smith or Jones or whoever and they accept Medicare, they're going to take your supplement insurance. If you have a Medicare Advantage plan and Dr. Smith or Jones or whoever tells you that you need to go see someone else, you must make sure that that someone else is part of your network. So with Medicare Advantage plans, they're network based. They're HMOs and PPOs, where with Medicare supplement insurance. There is no HMO or PPO. They're just the ABCs of supplements.
Okay. Okay. So if you had got medical care in another state, that would be more difficult under Medicare Advantage?
Potentially, it could be because they are probably outside of the network unless you have a PPO. And then you can go anywhere that you want. You just have to pay a higher copay amount or co-insurance amount.
Right.
Where with HMOs, they do cover you out for the most part. Most of them would cover you due to emergencies outside of your network, but they can say that they don't accept the assignment and you could potentially be billed a higher amount.
I see. Okay. Well, we haven't had any more questions, so thank you again. This was really a lot of information. Yeah, but very, very helpful. So thank you.
Thank you.
And yeah, Francis says thank you. Great. Okay, so I will get the recording link out to you and the link to the slides in the next few days. Oh, one more question. Teresa, can you sign up at Medicare.gov before you're 65?
Unfortunately, you cannot sign up unless you have your Medicare number already. So the answer is unfortunately not. You can look and do a generic search, but you cannot sign up for a personalized unless you have a Medicare number.
Okay. All right, great. Well, thank you again.
Thank you.
Okay, thank you everybody for coming.